I think that there's been a lot of developments and progress in the system in general, and it seems like the pillars are increasingly working together collaboratively, aligning the efforts in terms of measurement, the efforts in terms of identifying models of care that would improve quality in the system, but also aligning all of that with systems to ensure quality and safety on an ongoing basis with professionals. And that required really to listen to priorities of the system, listen to what types of information and what types of program would really address those priorities, so that we leverage performance information to garner quality improvements. And that's really the point. Nobody wants performance information to be released just for the sake of releasing this information. It has to support change. And one of the ways it can do that is by aligning it with audit programs to better understand processes of care and quality in hospitals, and aligning it then with quality improvement programs. So I think that by working together, we've been able to synergize those activities, really ensuring that the performance information that we produce at BHI is supporting accountability in the system, and that's really important. That's one of the key reasons why BHI was established. But it was always established so that it would also promote quality improvement and support really increasing quality and safety for patients. So I think that we've gone a long way, learning to work all together and really establishing the pillars as working in a system. The other thing I would say is that there's been an increasingly positive response from clinicians about the role of the BHI. So understanding that sometimes it's not always good news. Sometimes we unearth issues that would suggest that quality of care could improve. Sometimes we unearth the fact that there are variations in clinical care, and they're not always due to differences in patients' needs or expectations. But overall, I think that the response of the system has been positive to really look at this information, challenge it when it needs to be challenged, and then try to work on it. And that's really something that I think is a sign that the system is maturing in terms of using information in an intelligent way to support quality improvement. BHI is committed to be transparent. We publish all of the results of our validation studies as well, so that clinicians and managers can actually look at those validation measures, challenge them at times with an understanding of the impact of the decisions that we made. And that's the contribution that we wanted to make to the debate, so that people would go beyond questioning the data and then try to understand what it means and act on it. And I think that, again, over the last 3 years, there's been quite a lot of progress and development in New South Wales in using this information. And we have invested quite a lot of time to meet with clinicians, talk about the measures, so that they would better understand our role, what we do, and potentially how they could use this information to support quality improvement at the local level. And I think that this is extremely positive.